Dan Williams, Survive Outdoors. Today we have an unusual presentation that I had a few weeks ago on a lady, 40-year-old female that came into the clinic with just a small little 2-centimeter rash behind her knee. That's it. A little red, no ring, nothing else. She thinks she was bit by something. She's unsure of what that might have been. But that's all I had. No other associated symptoms whatsoever. Gave her a topical steroid cream, sent her on her way. She really didn't hear from her at all. She comes back about, 2 weeks later, and she did go to another clinic because she wasn't feeling well, saw an MD, and she was telling this MD that her eye was drooping and she was very concerned. That's all the symptoms she had at that point. He basically reassured her. She felt that her perception is that he thought she had a mental health issue. He didn't see anything wrong with her. Sent her on her way with no meds. She comes back to see me, and now it's 3 weeks since I've seen her the first time, and she has a complete paralysis of her face. Classic Bell's palsy, which affects the 7th cranial nerve, where you're drooping on one side of the face, just like the picture of this guy right here. And it happens, the age range on Bell palsy is 15 to about 45. She's 40 years old, she's in that range. A lot of things can cause Bell's palsy. Viruses, shingles can cause Bell's palsy, any kind of virus, and certain bacteria. So I was fortunate enough to have had a little bit of the history of this bite behind her knee, and immediately I wanted to draw a Lyme disease as well as ehrlichiosis and babesiosis to see if any of these were positive. I immediately put her on doxycycline for 3 weeks, acyclovir as well as prednisone to treat the Bell's palsy. And lo and behold, what comes back was a positive Lyme disease. You'll see it right here. She had 4 bands positive on the Western blot. So here's a situation where only 5% of all Lyme shows up as Bell's palsy. Now, if you look at the CDC, they're saying about 9 to 10% of all Lyme cases cause Bell's palsy. So nevertheless, it is not that common of a presentation. And here's a situation where you really need to know the history. She was out playing Frisbee golf, walked in the woods to get her Frisbee, comes out, and she evidently got a tick bite, which she never saw the tick. She just had that red rash on the back of her knee. Now with this rash here I'm going to show you, that is not Lyme disease rash at all. The erythema migrans I've talked about. And then this next picture is a classic erythema migrans. And so you see that one right there. So then this third photograph, which I've showed you before, is early disseminated Lyme. And I've presented that case, and that gentleman was about 3 months post-tick bite. He also was seen in a clinic and it was missed. Now this is a very easily missed diagnosis as Lyme disease, and part of the reason for that is clinicians aren't thinking about it, and many clinicians aren't trained in looking for all the signs and symptoms of Lyme disease. So what can you do if you get bit by a tick or you think you might have a symptom of Lyme disease? So one of the things you're going to do is, if you have the tick, put it in a plastic bag, and there are plenty of places you can send it off to, and you'll get those results back of what kind of tick it is and what kind of diseases it could carry. Now the deer tick, which is a picture here of the deer tick, can carry Lyme disease, babesiosis, and ehrlichiosis. I draw all 3 of those. Ehrlichiosis and Lyme is treated with the same antibiotic, doxycycline, and babesiosis is treated with either clindamycin or Zithromax. And I draw all 3 because it can be fairly common to have 2 of those 3 organisms. One of the things that's happening, I'm going to talk briefly about false prophets on wilderness medicine and on Lyme disease. There are nurses out there, there are doctors, there are providers, and some of these individuals they've experienced the breakdown in the healthcare system where it was missed, and they're angry and they're passionate and they're on a mission. Yes, is a Western blot the perfect test for Lyme? No, it's the best we have. However, there is a company called iGeneX.com where you can actually, for 20 bucks, you can get the blood test sent to your home, and you can just prick your finger, boom, send it out, and that is one way to go. And I researched this company, they're very reliable, a lot of good recommendations, and it is a very accurate test. My issue with these individuals is they become so passionate, they make generalizing statements. Do not get an infectious disease doctor. Do not have a PA. Do not have a nurse practitioner. We got to stop with the generalizations, okay? We're doing it in politics, we're doing it in medicine, and I'm here to tell you it does no good for anybody. You're going to very possibly run into a bad healthcare provider for Lyme disease, for an injury. It's going to happen. It's just like finding a mechanic for your car. So what do? You find someone else. You look around, you get recommendations, and that is what you need to do. This is your body. You need to check it out in terms of who you want to see and do some research. It's very important to do that. You're going to run into some bad providers. I see it all the time. And the good ones are out there. They do exist. So that's important to understand, and we got to stop with making these generalizations that all infectious disease individuals don't know anything about Lyme disease. Absolutely not true. There's some awesome infectious disease docs that are really excellent at what they do. For you, find a good provider. May take some time. If you are bitten by a tick, one of the things I want you to do is mention that. Mention you want a Lyme disease, you want an ehrlichiosis, and a babesiosis test. If the healthcare provider basically blows you off and goes, oh my gosh, here's another Google doc, a Google patient coming in here, then if his ego is that shattered and he's not listening to you, find someone else. All right? It makes sense to have those tests drawn if you are highly suspicious of having a tick illness. So, and the symptoms for Lyme disease are extensive, from muscle aches to a large joint aching you to headaches that are chronic. The other thing I wanted to mention also, which is really important, is that the antibodies for Lyme disease will not show up for a good 2 to 3, 4 weeks. So a lot of times what I'll do, if the person's bitten by a tick and I know it's a deer tick, I will go ahead and treat and want them to come back at a certain, and just follow them. Or another way you can do this is just wait. Nothing serious is going to happen in the first 3 weeks. Have them come back in 3 weeks, and then you can get your blood tests, and they're going to be much more accurate than drawing them early, where now you've just wasted some of their money, and that's the best way to do that in this clinician's opinion. All right, so there you have it, a very unusual presentation, Bell's palsy with Lyme disease. Watch out for those ticks. Keep your eyes on the rise and your face to the wind. I'll see you next time, guys. I almost forgot that they're doing a lot of research on correlating Alzheimer's and dementia patients with Lyme disease. Again, they are doing a lot of research. Nothing is founded yet, but could be a correlation with that, something we definitely want to look into. So just wanted to toss that out there. And here is a map showing some areas that are highly endemic for Lyme disease. Okay, I'm done now. See ya.